Hi everybody, my name is Rhys Barber. I'm one of the audiologists here at Audiology Associates.
And my name is Taylor Green, and this is my patient to start with. So we've got two patients in this video. This, you can see, very, very deep mixture of dead skin and a little bit of wax that's really pressed up against the eardrum here. What we've done straight away, we've gone straight in with the olive oil because you could see how dry this was looking to start with. The oil is not going to soften things now, but what it can do, basically what I'm doing here is I'm trying to move and clear a little gap around this dry skin that we can see. So that oil that we've popped in will just kind of slip underneath, and it can help us to slide these out a lot easier.
We had a question in the comment section on YouTube asking how we put the olive oil in. So we've got, we use a spray olive oil, so we use an olive oil called ear oil. So it's like a little spray bottle with a tapered nozzle you put in and just pump the top, and it puts a metered dose of olive oil in. It's one of the easiest ones we've found to put in. There are other manufacturers out there, but that's the one that we use.
Yeah, it's only a 10 milliliter bottle, so it's a little tiny little bottle like this. So it's easy to spray.
Yeah.
So you can see it's putting up quite a big fight for us. We've still, I think this is the fine end. Yeah, this is the fine end. So I had to think then. Such a small difference between them. So, right, you can already see here now. So what I'm doing here is I'm trying to draw this to the side.
That's probably why you've used the fine end, because it's really good for pinpoints or accuracy on there rather than this on the tube. Yeah,
a bit more precise. Sometimes we can get a little better grip as well on these little thinner pieces that are in there. So I was hoping that as we started to move this to the side, I was hoping this is all going to start peeling off the eardrum. But it's obviously not really going anywhere for us. It's really, really stuck in here, this.
It's quite deep, isn't it? So it does restrict your movement a little bit because you're right on top of the eardrum. So you can't sort of yank it all the way across, because that side, as it twists, is going to push against the drum.
Yeah. So this, again, this kind of medial sort of osseous portion of the ear canal is very, very sensitive. It's basically a very thin layer of skin on bone. Once we reach that the 2/3, the deeper 2/3 portion of the ear canal. Get my words out. So we've got the forceps in here now. So we're very, very gently trying to grab hold of that side here. Very slowly pull this out, because again, I don't know how attached this is to the eardrum. So you can see that side piece there is all starting to peel away. So that oil has worked really, really well in this case.
So why would you say, what in your opinion, what do you think, how do you think that's got down as deep as that is there?
Cotton buds.
Yeah,
it's very, very
the
typical.
We can tell when it's down in that deepermost third of the ear canal, wax isn't formed down in that very, very deep section. So if it's full from front to back, okay, we could expect there to be a little bit at the back. But when it's all clear in the front, but you've got this really deep section, it's always cotton buds or something that's been shoved in there.
Always.
And whenever you ask the patient, they've never used a cotton bud. So
never used one before. So we've actually got, now that we've removed that larger section, there was actually another piece that was firmly attached. So we're doing exactly the same here. So I'm actually attempting to see if this comes away off the eardrum, to see if this is loose or not. So we've got a little bit of movement. You can see the whole section of this dry wax is moving slightly. Here we go.
That's going. Look, it's like a penny. Go. It's really flat, isn't it?
They're very solid as well, very, very dry. It's obviously been there for quite a while, this. And you can see that smoother sort of layer of dead skin underneath on the back part that was up against the eardrum.
Well,
so we've managed, we've managed to clear it. I thought that was going to be quite a tricky one to
be. They sometimes are, aren't they? Those very, very deep sections that you just can't get a great grip on, and especially when they're so hard and flat, the suction tube doesn't always want to get that grip, and the olive oil does help with that as well. Will help to give you a little bit more of a grip on there.
So we had a centimetre then.
I was going to say, I talked right over that again.
Only a centimetre.
So this is actually my patient. So we try, if we're together, we're trying to do one of Taylor's, one of mine. Now mine's a little bit easier in fairness, because it's a little bit softer and it's right on that lateral portion of the ear canal there. So we can see It's very, very soft and sticky. Oh, guys,
Stretchy as well.
sorry. That's right. If you do enjoy the videos, don't forget to like, share, subscribe, heart, follow, thumbs up, all those things that you do on social media for me. That'd be brilliant. And there's one thing I forgot to say. Sorry, guys, I didn't post on Wednesday. I had a major editing software malfunction and it deleted everything I'd edited in for Wednesday. So you actually had Wednesday's video on Thursday. So
Technology, eh?
it's great. It is working well. But unfortunately, yeah, it crashed and it was like 5:30 at night and I just didn't have a chance to re-edit in before I had to go home. So yeah, sorry about that one, but you will get the videos moving forwards. I think me and Taylor are together for a couple of videos over this week as well. So we've got this really sort of dry section here now. It's starting to come away. It started off really soft and sticky. Now we've got this drier, stretchier section. Narrow little entrance to the ear canal. This is actually the fine end, so you can see just how narrow that canal entrance is. Difficulty with the fine ends, great for smaller gaps and precision work, not so great for suction power, is it? It doesn't really hold on as tightly. But you can see this long strip coming out there. Every piece we're taking away is pulling the next section forward, so it's all coming away really, really well here.
That's ideal.
Thanks guys for all the feedback as well regarding the medical terminology. I think you guys have got lateral and medial down now, so I don't know if I'll need to pop those words up on the screen. I think you kind of got the hang of that one. So we'll stick to and the tools as well. So like the standard size all in the tube, you've seen that a couple of times, fine end, Jobson horn. So you know the kind of the words we're using for those things. So we're going to start mixing a few more terms in over the next couple of videos, which will still pop up on the screen for you, no problem at all. But yeah, I think we won't need to do it for lateral medial now. I think you kind of got the grip of that one. So it's coming away really nicely. There we go.
It's always nice when it starts bringing those deeper sections.
Yeah, especially when you've got a narrow canal as well, isn't it? Because you really, it's so much easier when they're all coming forwards rather than have to kind of, because when you've got a very narrow canal, especially this one's got a quite a severe bend at the entrance. So if you don't forget, we're using straight tools in a bendy ear canal, so we have to be able to get those tools in at angles. You can sometimes put a slight bend on things like the fine end. I might put a bend on to get maybe into the recess, but most of the time we use them straight. There we are. We can see how the eardrum. It's looking good, isn't it? Really shiny.
Yeah.
If you want to see an eardrum that looks very different to that, we had one in last night's video actually. We had a retracted eardrum, so I'll try, if I remember, try and put a link up on the top there for you to see that one if you're watching this on YouTube. I'm not too sure you link it on any other platforms, to be honest, but if you're watching on YouTube, there'll be a link up in the corner.
I couldn't tell you.
I don't know. I'm still learning all this stuff all the time.
Still learning.
We're still learning. So this is the other ear canal. You can see a slightly wider entrance to the canal on this one, but still very, very sticky wax.
Yeah. And that's normally where the patient has used some drops before coming in.
Yeah.
So it normally affects the front section of the wax or the skin.
Yeah.
And then the deeper section that it hasn't quite got to is still quite dry, and sort of the core of it is usually a little bit dry.
Yeah, there's always that little sort of tough central core to it, isn't there? I've introduced a little bit of olive oil on this one just because the wax is so sticky. Every time I'm trying to get it to move, especially in those narrow ear canals as well, you're sticking from one side to the other here at the entrance to the canal.
Yeah.
So the olive oil is just going to stop that from re-sticking down, isn't it?
Yeah, so if you're wondering how we are able to get in these really tight spaces and maneuver this around, on the pinner, so the outer part of the ear, right at the entrance of the ear canal, that's more cartilage, so it's quite flexible. Now you'll feel it yourself if you're moving your ear around. You don't feel anything at all. So we hold the endoscope, the camera. We hold the ear open. So we basically put a little bit of pressure on the side to get that angle. So we open up the ear canal so we can get in there a lot easier.
So we introduced the Jobson horn here just because the suction wasn't able to grip enough to be able to pull this out. So the Jobson horn's gone in and we've bunched all this together. You can see that harder, darker section in the middle here, which is what we've got to grip on with the Jobson horn. Yep. But that's come away really nicely. Oh, that's looking good.
Always great to see when you manage to get that sticky wax all out in one go.
So you can actually see, that the handle of the malleus there. You can actually see the lateral process of the incus there a little bit as well through that eardrum. So this is, should I do inches? Just over 1¼ inches.
Yeah, what was that, 3 centimeters? Just over 3 centimeters.
There you go. So
roughly.
There was quite a bit, considering there were narrow entrances to the canals, and that's quite common sometimes to get a very narrow entrance to the canal, but the actual canal itself being still quite wide open, isn't it? So yeah, for considering it was a smaller space, it's quite a bit in there.
It can also be a possible reason why a lot of people with narrow ear canals do seem to produce a lot of wax, because those bendy narrow ear canals don't allow the wax to naturally migrate out of the ear as easy. Hence why a lot of people with narrow ear canals tend to have them done more often.
Regularly, yeah, that's right. We're going to nail this now. Right, you ready?
I think so.
They all took the mick out of us because we still can't get it.
Still can't get it right.
So as always, guys, take care of yourselves.
Take care of your ears.
And take care of one another. And we shall see you for the next video. Bye, everyone.
Nailed it.